Our next speaker, Dr. Ishrat Husain. Dr. Husain is a senior scientist and psychiatrist at UHN's Krembil Brain Institute. His work is focused on understanding and treating depression and other mood disorders. Outside the lab and clinic, Dr. Husain's favorite activity to help him de-stress is Muay Thai.
Let me introduce you to James, a 68-year-old retired bus driver who loves gardening. A few years ago, James was diagnosed with congestive heart failure. At first, he was diligent, going to all his appointments, taking his medications regularly, going for cardiac rehab. But over time, things began to change. His cardiologist noticed that he wasn't coming to follow up as much. And when he did arrive, his ankles were more swollen. He was increasingly short of breath. His heart failure was spiraling out of control, and his doctor didn't understand why. When I saw James, he looked tired. Not just physically tired, the type of tired that seeps through the soul. As I began to talk to James, it was clear to me, it wasn't just his heart that was failing him. It was his hope. James was depressed. I asked him about his medications. He said, "What's the point?" I asked him about going to cardiac rehab, and he said, "None of it matters anymore." It was clear to me that James's mental health was the biggest threat to his physical health at that moment. And yet nobody had asked him how he was feeling. Once we began to treat James's depression, something remarkable happened. He began to engage more, started going for rehab, taking his medications. He even started gardening again. And James's story isn't unique. Work from our lab has shown that in people with congestive heart failure, those that have co-occurring depression are at a 25% higher risk of death than those without it. What this tells us is simple but profound. You cannot heal the body without caring for the mind. I started my journey in mental health research when I discovered that up to 30% of people with depression have evidence of high inflammation. And it appears that this relationship is bidirectional, because in people with chronic physical health conditions, particularly inflammatory conditions like arthritis or inflammatory bowel disease, they're at higher risk of mental illness, especially depression. The brain and body are clearly closely intertwined, yet we continue to treat them in isolation. My lab is focused on advancing the understanding and treatment of depression by simultaneously evaluating biological, psychological, social, and cultural contributors to illness. For example, we led the first trial of a repurposed anti-inflammatory antibiotic for the treatment of severe and persistent depression, showing large antidepressant effects. We've also used sophisticated brain imaging called positron emission tomography, or PET scanning, to evaluate inflammatory brain cells called astrocytes, which when disrupted may be contributing to the onset of depression and bipolar disorders in a subgroup of people. This work has led to the development of novel clinical trials targeting these brain cells. But focusing on a singular approach like biology overlooks the complexity of mental illness, which is why my lab, along with international collaborators, is also looking at scalable psychological interventions that can truly make an impact on depression at a societal level. For example, we developed an intervention called Learning Through Play Plus DADS. It combines cognitive behavior therapy and parenting skills training to treat fathers of young children with depression. We tested Learning Through Play Plus DADS in over 350 fathers with depression, showing that not only did it improve depression, reduced anxiety, improved quality of life, it also reduced parenting stress. And the intervention had ripple effects. It led to an improved quality of relationship between fathers and their partners. It led to a reduction in intimate partner violence between the couple. And most encouragingly, it protected kids. It led to better social and emotional development, meaning that kids were able to interact better with other children, they were able to recognize emotions, and had healthier attachment with their own parents. So the intervention was protective for the kids' mental health as they grow older. This work has led to the expansion of this treatment to over 5,000 parents with depression. And these are just some examples of the amazing research at the Krembil Brain Institute. As director of the CAMH-UHN partnership, I see an immense opportunity, a world first, two of the country's leading academic health centers coming together to truly break down the silos between mental and physical health. The aim of the partnership is to advance integrated mental and physical health care, accelerate brain-body science, and to upskill the health workforce so that we can equitably treat mental and physical health problems. By doing so, we're hoping to create a more connected and responsive health system so that people like James don't have to suffer in silence any longer. Thank you.
Thanks very much, Ishrat. So you were saying that we still tend, though, to separate the physical from the mental, right, when it comes to treating patients. What then is the best model of care for patients, and can we achieve this?
I think I alluded to it in my talk. To me, the best model of care is simply asking patients how they're feeling, not just physically, but emotionally and psychologically as well. And we have an example of a great model right here at UHN. We have a clinic called the Mental Health and Medicine Clinic, through which patients in any clinical program, whether it's rheumatology, medicine, if the healthcare providers there notice that they're not feeling well emotionally or psychologically, they can access specialist mental health care. And we've seen great outcomes within this program, which was interestingly philanthropically supported and has now been scaled up through sustainable funding and is self-sustainable. So it's an example of a really good model.
Wonderful. Okay, thanks very much. Ishrat Husain. Thank you, Ishrat.